from lack to the abundance. Hey, from defeated to winning. Hey, from defeated to winning. You want to open your mouth and say, I'm going from defeated to winning. He got to change your location. From defeated to winning. That won't be your story no more. Now listen, I know we're out of recording, but can we make this our sanctuary tonight? I want you to think about that thing, and I want you to look at somebody. As a matter of fact, grab the hand of the person you're standing next to and lift your hand in the air. That's it, lift your hand in the air. I don't know what the enemy has been using against you to keep you from being what God wants you to be, but I came to tell somebody that that's about to change. I speak to everything that's been holding you captive, and I command it to let you go, to let you go. Lift your voice and say, God is changing our story. God is changing our life. God is changing our life. I know what it looked like before. I know what it felt like before. But he's releasing healing right now. He's releasing healing right now. God is saying, oh, this won't be my story no more. Lift your hands all over the room and say, this won't be my story no more. That thing that's been keeping you up at night won't be. This won't be my story no more. Having just enough just to get by won't be you. This won't be my story no more. God came in to pull you where you belong. Oh yes, he did. This won't be my story no more. God came to break you out of some stuff tonight. Oh yes, he did. This won't be my I don't care how long you've been bound. He came to break you out tonight. Hey, he came to break you out tonight. Yeah. Lift your hands all over this room. And if don't nobody else get it, read it for your home tonight. As your hands are lifted up high, I need you out of your own mouth to begin to shout in the atmosphere. God is changing my story. Open your mouth and shout it like you, shout it like you. You want me to say, you want me to say, he's turning that thing around. He's turning that. Somebody open your mouth. Oh no, that won't be your story no more. Everybody say that won't be. That won't be. Lift your hands and say, this won't be mine. One more time like you mean it. This won't be. Now you ought to open your mouth and bless him like you believe that he's not going to change your story, but he's already changed. I need somebody to open up your mouth and get what is yours tonight. I said get what is yours tonight. I just believe that wherever the Spirit of the Lord is, everything you need is there. Open your mouth. Believe in my spirit.
Now I want everybody to clap.
Good evening, everyone. Welcome, welcome, welcome to Destiny on Tonight. We are so excited that you are with us tonight. We are going to have a different type of enrichment study. We have a very well noted physician with us on tonight. This is Mrs. Schquthia Peacock. She has been my doctor for years and years. I used to work for her, helped her get things situated in her practice and everything. And I'm so excited she's with us tonight. Now, before you make any final decisions or anything, she is here to share with us and talk to us about the COVID-19 vaccine. And I want you to be open. I want you to have questions ready. This is the opportunity. So the Bible tells us we perish for a lack of knowledge. And so we need to have the understanding whether we decide to take it or not. We still need that understanding. So without further ado, I'm going to turn this over to Miss Peacock, my Miss Peacock. Welcome, Miss Peacock.
Great. Can you hear me okay? Yeah, okay, so great. So a little bit of introduction about me. I'm Schquthia Peacock. I'm a family nurse practitioner. I work at Preston Medical Associates, a family practice in Cary. I have been there since I graduated in '99 from UNC Chapel Hill, and have enjoyed my practice caring for people across the age range. I think right now my youngest is 5 and my oldest is 89. So I do enjoy caring for people across the lifespan. I've enjoyed having a great relationship with my Miss Shirley, I call her. And as I'm sure many of you call her different things, but I always call her my Miss Shirley. I wanted to make sure that we had a chance to share some information about the vaccine and want to kind of make it a somewhat of a discussion as best we can when it comes to virtual learning. It looks like you probably have the ability to put things in the chat around in regards to questions. I'm sure many people have lots of questions in regards to the vaccine. And the vaccine, I'd like to share that I got my first shot on Thursday last week, which was a rewarding experience because I've been caring for people with COVID since March, since the virus was first detected in North Carolina back in March. Just this past week, and actually currently caring for a couple of patients that are having a pretty good, a difficult time with the virus. With lots of shortness of breath, lots of fatigue, significant enough that we asked them to go to the emergency room for additional care. And we did go, they went, and it was an assessment that they deemed it wasn't severe enough for him to be in the hospital, despite him having a very low oxygen saturation of about 95%, 94, 95%. Oxygen saturation, a respiration rate of about 28, and his heart rate into the 120s. So significant. Yeah, he was very sick, but because the hospitals are so full right now, they did not have a place for him. There was a need for people that were more severely sick to have room in the hospital. So they sent him back home to monitor his symptoms. Luckily, he is doing well. He had his first day after the past 10 of not having a temperature increase. His temperature had been up as high as 101 or 102. So we're very thankful and blessed to have him without fever since Tuesday. He was diagnosed with COVID pneumonia prior to going. His whole household is sick with COVID. And another one in the household, his son has COVID pneumonia that will get him through this next week, will be kind of critical for him. So that just as a backdrop that kind of gives you a little bit of idea of how significant the virus is impacting communities and households and how dangerous it is, which kind of, like I said, gives us the backdrop to a conversation around the vaccine. I have a few things that I wanted to share on the screen. So let's see if we could do that. I have a slide deck that is from the health department and a few slides that I've kind of put together that gives a little bit of a little bit more detail around the vaccine itself. So let me see if I can get into it looks like I'm still disabled in regards to sharing the screen. So maybe they can work on that on the back end while I kind of get things loaded up over here to be able to do that. Slide share also. So the vaccine came to the Triangle back in December, and it was listed as our release to some of the major areas of hospitals and long-term care facilities just recently, and then to the health departments around the area, giving people the access to the vaccine in the community. There are a couple of phases that are used to kind of denote who needs to get vaccinated first. Let's see if we're at the point where we can share. Oh, yes, we are. So let's see if we can go with desktop here first. So with those groups that we have available to share, let's see here, let's try that again. Let's see if we can get that to share. Preferences. So it looks like my security is not allowing me to share. So hold on one second. So the vaccines are right now currently, while I'm working through a couple of security issues with Zoom. Let's see if that does it. With that being said, there are several areas where we can get vaccine, and that's where they've been distributed, which is what I said, into the area hospitals, into the area local and local health departments. Health departments are in each individual county. So of course, the one that is most accessible to most of you is going to be the Wake County Health Department, I would imagine, with it being located here in the Triangle. The Durham County Health Department also, and then again, the area hospitals, Wake Med, UNC Rex Hospital, and Duke Hospital are the others. So let's see if this allows me to do what I wanted to do. I apologize for this. I thought I had worked that out. There we go. All right, so hopefully you can see those. So that is, like I said, the initial slide deck from the Department of Health and Human Services from North Carolina. That's given me the privilege to be able to share some information about the vaccine with you all. And so to start with, we talked about that those vaccines are currently at the area hospitals and the local health departments, and now being disseminated or being distributed to the long-term care facilities, where, as you can imagine, it's been a big impact in those long-term care facilities, given as a result, leaving lots of families to be separated from their loved ones and leading to some fatalities in that instance too. So we have here, soon the vaccine, let's take that away. Soon the vaccine will be available to protect you. It's a free of charge vaccine, so it doesn't have any cost associated with it for anyone who wants to receive it. And of course, I'm certainly a proponent and encourage everyone to take advantage of it. I know that lots of distrust has been built around a lot of things coming through from the government, considering this is certainly a government funded project, but to know that racism and socioeconomic status and healthcare systems have been working to balance out the impact of impacting access to care and access to this vaccine, to eliminate the risk of concerns about maltreatment and the vaccine not being tested appropriately throughout the communities. So we want to work to build, and that's why I actually, as we start there, have made a big push to make sure that I'm working to get education out in regards to the vaccines to the community. That's my way of giving back to the community, is to use my expertise to answer questions in regards to the vaccine. So we want to draw amongst the expertise of leaders and healthcare providers in the community, and people who are trusted resources of information. So I use my, my platform to share that information with you and with my family and my patients in the community. The vaccine has been tested and trusted. I mean, it can be trusted. A lot of people have questions and concerns around the vaccine and thinking that it's been rushed, but to know that it has been tested and with lots of volunteers. Pfizer vaccine had over 40,000 volunteers that tested the vaccine or was part of the research study. And the Moderna vaccine, the other vaccine, which we'll get into the details of those, had over 30,000 people. And that's within the United States. That's not including those studies that were tested in other countries outside of the United States. It's currently already been administered in Europe. So the vaccine has had lots of research to back it. It has seemed to be what people consider kind of rushed, but to know that, and we'll get into some of those details in some of the slides to come, that those, the research was done many years prior in regards to the vaccines for things like SARS and MERS, a couple of other coronaviruses. And we'll get into those details in some of the slides to come also. This jumped a little bit ahead of time, but the scientists have had a head start in working with similar vaccines. Like as I mentioned before, MERS, a vaccine that, a virus that was out in the Middle East, and SARS, and I'm sure many of you had experience with that. And that was started in some of the areas in Asia. And you see here, this is a picture of Kamizika Corbett, who is an immunologist who graduated from UNC Chapel Hill and was a leader in designing and developing the Pfizer vaccine. As you can see, she's an African-American female and actually from Hurdle Mills, North Carolina. So she's one of our very own and alum of one of my university myself that I attended, and that's UNC Chapel Hill. So she's an immunologist with Pfizer and worked really hard to make sure that they were able to isolate the genome that the coronavirus is made of to insert it inside the Pfizer vaccine to make it an RNA vaccine. Again, we discussed about the idea that this vaccine is safe and effective, both the Pfizer, which is also paired with BioNTech, and the Moderna vaccine. All of the vaccines have been tested. We mentioned that 40,000 participants in the Pfizer vaccine study and 30,000 vaccine participants with the Moderna study, coming up with the 70,000 people who volunteered for the study. And I think I would have actually volunteered for the study too, if I had time to devote to it, because I wanted to show my colleagues and my patients and my friends that it was a worthwhile investment in our energy and our to show that the vaccine could be tested and used in African Americans, and to know that it would be considered safe and effective. And to date, 95% effective, the coronavirus vaccines have been in preventing coronavirus or COVID-19, and without any serious safety concerns. And I've known that it's been a little bit of information in the media about some of the side effects around, especially the Pfizer vaccine. And I want to say that side effects are known in regards to any of the vaccines. I'm not sure how many of you have had the shingles vaccine, but it too can give some of those similar side effects. We'll go over a little bit of what those are in another little slide that I've prepared that we can do at the end of this one that goes over some of the common side effects. But those side effects are not significant in their presentation to the patient, meaning a little bit of arm soreness. You will have a little bit of fatigue, headache for some. For me, as I mentioned before, I had the vaccine on Thursday of last week, and I had some arm soreness that started maybe about 3 hours after my injection and carried over to the next day slightly. I put it on the lines of a tetanus shot. I'm sure many of you have had a tetanus shot and have had some arm soreness. And how I recommend people to alleviate that is to use their dominant arm when they get their vaccine. so that they can have good use of that arm to help move that medicine that's been injected into that muscle, so it can, to move that muscle so it can be absorbed into the local tissue so it doesn't sit there. That achiness usually comes because that medicine's sitting right in the arm. And I'm touching my left arm because that's the arm I used to get my vaccine. Again, those are temporary things. I mentioned sore arm, headache, feeling tired for a day or two. And for me, it was less than 24 hours. They've, both Pfizer and Moderna have made a big impact, or a big attempt to incorporate as many diverse populations in their research studies. And you could see, again, the importance of us as African Americans or any minorities to participate in studies is to make sure that we have an adequate representation of our ethnicity in those research studies. So Pfizer vaccine had about 10% of African American, about 26% of Hispanics or Latinx, and the Moderna, again, about 10% and about 20% of Hispanic in the Moderna vaccine. Again, still a majority of those Caucasian or white, but they tried to make it a representation of what the population would be. And that's to be, spend a little bit more time on that, to say that in doing that, typically in the past, research didn't always target a very diverse population. So making a point to make the population as diverse as possible so we can see what those anticipated side effects are going to be in different populations. And another common concern people have around getting the COVID vaccine or getting a vaccine in general, but people have particularly had a concern about this with the COVID vaccine, is that whether or not you can get coronavirus from the vaccine. So the vaccine is actually, when it comes to Pfizer and the Moderna vaccines, it's a mRNA vaccine where they take a piece of the genome from the coronavirus to put inside of the virus, in the vaccine. And then that vaccine is then injected into the person, or into, like they did injected into me, and your body makes an antibody against it. So the vaccine body makes antibodies against it, and then those antibodies attack the virus. And to note, you see that this is yellow like the sun and has, beams coming from it, what we would call the corona, giving the virus the name coronavirus. So it looks like the corona of the sun. But the body does not, or the vaccine does not have any active virus in it. It is a component of COVID-19 that then is put inside the virus, and then that vaccine is injected into the patient or through the person, and then your body makes antibodies against it. And those antibodies are left for your body to use in the instance that you have a interaction with a COVID exposure, so that your body can eradicate and destroy, or at least dampen the response of what that coronavirus exposure would lead to in regards to virus symptoms. So the vaccine, again, creates antibodies in your body, and those antibodies attack the virus if you were exposed to coronavirus. The vaccine is composed of 2 shots. My first shot, again, was on Thursday. My second one is 3 weeks later, which would be the 4th. Both the Moderna and the Pfizer vaccines are recommended as 2-shot vaccines. The Pfizer vaccine is more at the 3-week duration, and the Moderna vaccine is more at the 4-week duration. And that's from the first vaccine that you would get. And the second shot is very important. I should make sure to mention that, is that the first shot gives your body like a signal that this foreign, meaning the virus or the RNA from that virus is present. So your body mounts a defense against it, creating those antibodies. Those antibodies are shored up or finalized, I guess you could say, with that second shot, signifying that your body has then enough immunity to attack any exposure to coronavirus in the future. And then dampening or lessening your response, and hopefully leading to you not developing the virus or of COVID-19, or making it a milder case, so that you don't end up, as I mentioned before, a patient with significant symptoms resulting in hospitalization. And of course, hospitalization is certainly those people at risk of hospitalization then are at risk of more long-term risk in regards to the virus. This is an exciting fact. More than 5.9 million Americans have already been vaccinated against the virus, and that's getting their first dose, and that was as of January 7th of 2021. And that's considering the rollout started in December. So that's a pretty big rollout. I know that our state is receiving vaccine on a weekly basis. And that's how they devise or determine how many appointments are made for that week. And we'll talk a little bit as we go through this presentation about how to make one of those appointments. To note here, a couple of important people getting vaccines. That's Governor Jim Hunt there. I'm not sure how many of you are aware of who he is, but he was what I call my first candidate that I voted for when I was in elementary school in a mock election. But he was the governor that I grew up with in elementary school as well as in high school. So a very known face in my family and in my understanding of what happens in the legislative process. And another representative that I've had a chance to chat with, Representative Shelley Cunningham, talks about his reason that he actually is vaccinated so he can have time with his grandkids. And many elders have been isolated, and hopefully this vaccine will give them a little reassurance that they can come out of their houses and interact with others more, knowing that they're protected with the vaccine. When people are screened for coronavirus in our office, and when you are given a vaccine for coronavirus, whether it be the Pfizer or the Moderna vaccine, the state collects your personal information so that they can contact you when it's time for you to get your second vaccine. So to know that that information is your personal information and is protected at all times by the Department of Health and Human Services. But it's used for tracking and to communicate when you're due for your second vaccine. The second vaccine, or my second vaccine, was scheduled at the time of my first vaccine to ensure that I was in line. I was not going to have to worry about trying to secure my second vaccine. It's already been secured. A little side note, I don't think this is pointed out throughout the slides, but that second vaccine should stay, should also be the vaccine manufacturer that you had the first time. You shouldn't mix the two vaccines, meaning if you start with Pfizer, you should end with Pfizer. If you start with Moderna, you should end with Moderna. And again, those vaccines are available and free. And as you can see through the media, that the supply seem to be limited. I will say that there are several, hundreds of thousands vaccines in North Carolina that have been disseminated across the state, again, to health departments across the state. And, we have 100 counties in North Carolina. So all of the 100 counties of North Carolina have gotten vaccine. And the area hospitals, starting out with 11 of the major hospitals in the Triangle area or across North Carolina got vaccine first, and that was the Pfizer BioNTech vaccine. And then we're now starting to see a little bit of the Moderna vaccine start to roll out. The vaccine is the best way to fight COVID-19. and slow to spread, and hopefully it will reduce fatalities as a result of the vaccine. The vaccine supply will continue to roll out throughout 2021. There's plenty of it being manufactured, especially in regards to the Pfizer vaccine. They're saying that they will have over 1 billion vaccines available by the end of 2021. So I think there's not going to be a risk of it running out. We just have to wait our turn to get it, and prioritizing it to those people who are at the highest risk and those people who are more likely to have fatality as a result of getting the virus. And that's why they're focusing on long-term care facilities. And if you have no insurance, of course, no need to worry because it's free to everyone. This goes over the prioritization of people, residents of North Carolina. And right now we're in group 2. We just progressed to group 2, or what we call the revised group 2, earlier this month, starting out with healthcare workers and long-term care residents. So I was able to be classified as level 1 candidate. And let me just pop over here to another screen so that I can show you what those level 1 candidates, potential people are. So those are people who are working in hospitals, long-term care facilities, outpatient clinics, vaccination sites. So anyone that's doing a vaccine drive-up clinic would be considered that level 1. Home care assistants and workers, public health clinical services, EMS, morticians, pharmacists. The list goes on. Behavioral health workers, blood bank workers, chiropractors, nurses' aides, nurse practitioners like me, personal care aides, phlebotomists are all considered level 1 or group 1. And again, those people who are staff and residents of long-term care facilities, and that's including those that are family care homes and group homes, anyone that's going to be in a congregate living environment. And then let's get back to our slides. That second group is considered older adults, which of course is kind of general. Like, what is that defined as? That second group, older adults, are considered those that are 65 years and older should be vaccinated in that group 2. Initially it was 75 years and older, and if you had certain qualifying health conditions, but right now it's anyone over the age of 65 is considered a candidate to receive a vaccine. All right, back to those slides. And then frontline essential workers, so that would be people working in grocery stores, people working in fast food, people working in mail delivery would be in that category too. Probably also in there police officers, because I didn't see them listed in the healthcare workers category, that would come in contact with people. Fourth group, any adults with high risk exposure that weren't listed above and have increased risk with severe illnesses, meaning that they have chronic illnesses. And then everyone in the group 5 would be everyone that's residual. They've moved pretty quickly, starting out in December with the group 1, and here we are in January in group 2. So they're moving a lot quicker than I anticipated. There's no timeline as to when the next groups will be activated, but it does seem to be quicker than I anticipated. Vaccines across North Carolina, like I said, started in January. This is as of January 2021. And healthcare workers, we talked about that, long-term care facility workers that are all now been activated, and including those adults older than 65, all are considered candidates for vaccine at this moment. Again, North Carolina receives shipments on a regular basis, and those are shipped from the federal government to the North Carolina Department of Health and Human Services, who then ships those to individual vaccine providers. We are not at a point that we are getting those into the hands of family practices or local community practices yet, but I would imagine that's going to be forthcoming and hopefully in the next few weeks, but certainly in the next few months. Now, how do you find your spot for your shot? So if you're in one of those categories, it's a phone number that you can call, and that's 1-877-490-6642, or you can go to yourshot.nc.gov to register through the Department of Health and Human Services. That will give you a list of area facilities based on the county that you're, per county. So it's outlined by county to decide if you want to, and you can choose to go to the county that you reside in or one of the area counties. They're not discriminating. Each county that you go to, you can choose any county to register to receive your vaccine. So there's no discrimination in regards to that, meaning if you're a resident of Durham County, you can certainly still register in Orange County. I am a resident of Durham County and I got my vaccine in Wake County, but that's where I spend most of my time is in Wake County. So it's more convenient for me to get my vaccine in Wake County. Again, we want to make sure we're keeping all of all the North Carolinians informed on how to get your shot and take your spot, and keeping a check out on the Your Spot, Your Shot website that we just talked about, because it would have an outline of updated information in regards to the group activation, as well as the locations where you can have access to a vaccine. See. So just a few more on this. And this talks of a couple of medical professional organizations that are encouraging people to get vaccinated. And of course, the North Carolina Nurses, the American Nurses Association, the National Black Nurses Association, and American Medical Association are some of the major ones. A couple of online resources that can be used to educate yourself, again, on that yourshot.northcarolina.gov are great ways to educate yourself around the vaccine. And you see a couple of those things that I've used already, and that's that infographic that goes over the groups. And then we have that slide deck that I'm actually currently in to give you some overview of what's coming from the Department of Health and Human Services. And I couldn't be more thorough, but to mention how important it is to practice the 3 W's. And that's to make sure you're wearing and washing your hands, wearing your mask, washing your hands, and waiting your proper distance of 6 feet when you're standing with other people to prevent the spread. And of course, that 6 feet is as a judgment call, as it's about that distance for a droplet to drop and settle and not land on you if you're in front of someone. And if we work together, we can make sure we can lessen the spread of COVID in the community. So I do want to go to one more spot here because I wanted to share with you a little bit of information on more specifically in regards to coronavirus and the vaccine that may cause you to have a few questions that would pop up. And that is a little bit about what coronavirus is. And again, we gave you a little bit of a description of coronavirus and how it got its name, and that it's a virus that has spikes on it, kind of like a corona, like the beams of sun coming from the sun, giving it the term coronavirus. And I wanted to mention here, as I was telling you before, there are many different types of coronaviruses. There are at least 7, as you can see here. And some of the more common ones that are we have heard a lot about in the media, and that's MERS, which is the Middle East respiratory virus that was out in the 2000s. SARS, the same thing. And then here in 2019, we had SARS-CoV-2. So these MERS and SARS were the start of the development of coronavirus, the COVID vaccine. We're just at a point now that they were able to isolate the genome for SARS-CoV-2 to put it inside, or the RNA inside of the Pfizer and the Moderna vaccines. So the history goes back to the 2000s, early 2000s, in regards to vaccine development. So when people say that it's been rushed, it's truly not been rushed. The process of the research behind the Pfizer vaccine and the Moderna vaccines were sped up. I wouldn't say necessarily rushed, but they were sped up so that they can get the vaccine quickly out to the public. So they went through the proper stages. They just sped up the process, but knowing that the history of the vaccine research goes back to the 2000s. Then we have another slide here. Let's see if that advances it, and it does. And that's the Pfizer vaccine. And it talks about the amount of participants that were in the Pfizer study. As I mentioned before, 43,000 people were participated in the Pfizer vaccine study. And 94% of those had confirmed cases of coronavirus. And some of those were placebo, giving it a effectiveness of 95%. A little bit of backstory on the Pfizer vaccine is that it needs to be stored at a very cold, minus 80 degrees. And that minus 80 degrees is what prevents it in going into some of the local community offices. So we will not likely get Pfizer vaccine in our office. We would likely get Moderna, as you can see on the next slide here. Actually, maybe not there because it seems like it's skipping.
Ms. Peacock, I don't think we're seeing those slides. I don't think we're seeing
those? Okay, did you see the first ones though?
I think we haven't seen anything since your shop.
Okay, all right, okay. All right, let me see if I can activate that. Thank you, Ms. Shirley. Let's see if we can stop and share again. Thank you. Let me start over for that one. Share. You see that there?
Yes, ma'am. We
Okay,
do.
All right, so let me go back to the coronavirus there. We were mentioning that the coronavirus has 7 different strains over time. There has been 7 different coronaviruses, I guess you could say. And MERS is one, Middle Eastern Respiratory Virus, and SARS, and then the SARS-CoV-2, which of course came out in 2019, originating in Wuhan, China. And again, 7 of those. And these 3 date back to the 2000s. So meaning that the research in regards to coronavirus and them trying to devise a vaccine for one of those coronaviruses dates back to that duration too. All right, and then 43,000 participants in the Pfizer study. And we talked about the temperature being 80 degrees, minus 80 degrees in order for storage, limiting the availability of that vaccine in the community. So it's going to be more associated with health departments and associated with hospitals and the pharmacies like CVS and Walgreens are going to be instrumental in distributing vaccine, and they have been in long-term care facilities doing vaccinations. And so those are the places that have the capabilities of storing the Pfizer vaccine. And I'm going to skip that one just a second there. And then the Moderna vaccine, over 30,000 participants in the United States. And again, the same thing with Moderna, the Pfizer vaccine, is that was 43,000 participants in the US. That's not including those in other countries. So those numbers are well above the that 70,000 if you go worldwide. The temperature storage for the Moderna vaccine is going to be more aligned what would be considered the storage in a residential freezer. So that's going to open up the availability of the Moderna vaccine to be available to community practices like mine, and therefore open up the availability for it to be available to the community. So right now, most healthcare providers are getting the Pfizer vaccine, and I would imagine most of the general public would get more of the Moderna vaccine because that's going to be more accessible to the community. And so I want to talk a little bit about the coronavirus, and a lot of people wonder how is it that people have so many varied symptoms around the virus. And it is a respiratory virus, but it does have extra impact, has additional impact in other systems of the body. And that's because the virus attacks all areas of the body. So using this as an example of the importance of getting vaccinated so we can limit the impact on our bodies and long-term potential complications of the virus. And so it has an impact on neurologic symptoms. It has an impact on our kidneys, leading to kidney injury. You know, some people may end up on dialysis as a result. People oftentimes have an elevation in their liver function, which can lead to liver damage. People complain a lot of a loss of sense of taste and smell. It actually doesn't show the face on this diagram, but that's as a result of the virus attacking cells in the nasal passages. People oftentimes have diarrhea and GI distress, of nausea and vomiting with the virus because it attacks cells that are in our intestinal tract. People can have, I'm not sure if you knew that rash is one of those symptoms of the virus. People have rash associated with that. Blood sugar abnormalities as a result of that. And some of the more fatal things is that people can have a myocardial infarction or heart attack from it, a stroke from this, deep vein thrombosis, so people can develop pulmonary embolisms from this, leading to sudden death. So, and those are effects of the coronavirus itself. Certainly for me is more significant of a concern than any of what I call some of the milder symptoms of typical injection of arm soreness and fatigue associated with an injection. It talks about some of those adverse events or side effects that can come from taking a COVID vaccine, arm swelling, and it gives you a little bit of a percentage of those coming out of the research studies. Myalgias, which is called what we would call joint pain or muscle pain, about 9% was represented in the Moderna vaccine. Joint pain, about 5% in the Moderna vaccine. Temperature increase of less than 2% in both the Moderna and the Pfizer vaccine studies. Fatigue, 9 to 10% in the Moderna study and 3 to 4% in the Pfizer study, and headache about 4% in the Moderna study and 2% in the Pfizer study. So certainly a lot milder and less significant, and certainly not fatal adverse side effects in regards to the vaccine, whereas the virus itself can lead to unfortunately death in many, or in some people, I wouldn't say necessarily, certainly not many, but has certainly up until this time, I think we're at across the United States, 400,000 people who have died from the virus. That's certainly significant, and that could be reduced significantly with proper administration of the vaccine. Again, that's that group vaccine distribution that you have to find out where you are, and you can go to that yourspotyourshot.nc.gov to register based on your county. And I will say, I'm going to stop sharing this slide here so we can see if there's any questions in the chat. And we can go over some of those questions, and want to make sure that people know that we went over some of the locations that you can get a vaccine in through the health departments. But again, there are also avenues to the vaccine through some of your local hospitals. The UNC hospital system has a vaccine distribution plan also, and it's called Your Shot. I've just done a Google search for Your Shot and UNC and came up with theirs. Duke Hospital the same, doing a Google search for Duke and COVID vaccine will give you their vaccine distribution. And the other, and Rex, keep in mind, Rex and UNC are going to be the same. Wake Med has a distribution too. And right now theirs is mostly tied to their Wake faculty or their Wake practices, Wake Med practices. They haven't really opened it up greatly to the community yet. So there is a question in the chat. What is the distribution?
Miss Peacock, I think you've got about 4 questions in the chat, but I want to ask you my questions first.
Yes, please do.
My first question is, what about if you have, well, I might have 4 questions. 1, what about allergies? And if you're allergic to penicillin?
Right, okay. So allergic to penicillin, there's no contraindication with the vaccine. So the allergies, there was some news media discussion about allergies. Maybe I think that came out when people first started getting the vaccine, maybe in late December. And those people were people who had significant allergies, and actually significant allergies that they carry an EpiPen. And EpiPens are used when people have anaphylactic shock. And they have lots of, those people in that study had lots of allergies to different things, not necessarily allergies to insect bites. So it wasn't a bee sting allergy. They had, a list of allergies that was extremely long. So if you have a need to carry an EpiPen, you should check with your healthcare provider about the best approach to vaccine for you. So penicillin, not a concern. If you have a typical antibiotic sensitivity or allergy, not a concern. If you have a sensitivity to, there's been a lot of talk about ACE inhibitors because this vaccine, impacts ACE receptors. And they're the ACE1, ACE2 receptors, and those ACE2 receptors are throughout some of the body systems that we showed on the previous screen. It's not a concern in regards to getting the vaccine either. You want to make sure that you are not allergic to any of the inert ingredients that are in the vaccine, and those would be laid out and can be discussed with you more with your primary care provider.
All right, my next question is, the shingles vaccine is in 2 doses also. So suppose if you're due to have your 2nd dose of shingles and you get a call and you say, okay, you come in and get your COVID vaccine. Would that be advisable? Should there be a separated time between the shingles and the COVID?
Yes, there should be. And let me draw a comparison between the 2 vaccines. And Ms. Shirley, have you had your shingles vaccine?
I've had my first shot. My 2nd shot, I'm due Monday.
And did you have any adverse effect from your first shot?
No, just a sore arm.
All right. That's exactly the same concept of having a COVID vaccine. Some people have, the way I describe it is that the shingles shot is a big vaccine, meaning your body's going to make a big response to it. The side effects that were noted on the previous screen is your body's response to the vaccine, to your body's immune system making a response to the vaccine. So the myalgia or the increase in temperature, those type things is your body's immune system making a response to the vaccine. And because your body makes that response to the vaccine, that's positive, that's good. It means that your body's doing what it needs to do to make that
Okay,
response.
but
So
they should be separated.
yes, yes. And so now to the point of how long they should be separated, at
Yeah.
least 2 weeks.
At least 2 weeks.
Exactly. So I tell people, if you are right now in line to get a COVID vaccine and you are upcoming on your need to have a shingles vaccine or any other vaccine for that matter, and you're on a wait list and could be in either that group 1 or group 2 right now, I think I would hold on that second vaccine of shingles, because that can happen at any time, because I don't want to delay you in getting your COVID vaccine.
Okay. So this is my last question, then you can answer the questions in the chat. Looking back at the statistics and the coronaviruses that have been, was this one expected?
No, well, no, no, it
Okay.
wasn't expected.
Okay.
And it certainly caught everybody off guard.
Okay.
And meaning off guard more countries, certain countries more than others. I think here in the United States, we were more off guard than the average country. But it was not a planned virus. You know, it wasn't something that was designed in a lab. It was a mutation in the environment that this came about. And you've heard a lot about the wet markets of China and a lot of exposure to different animals and animals in small quarters that were not kept very clean and left the risk of mutation. And that virus mutated and caused this COVID or coronavirus COVID-2 to come out or to be developed, you know, and infect a human. So that infection then spread through Wuhan, China, and then spread outside of China. And then we wonder how quickly it spread. So a little scenario is that I have a patient that stays part-time in the United States and part-time in Taiwan. He was in Taiwan in December and realized that the United States was starting to shut borders. So he said in January, he should make his way back to the United States. Now this is January, before we were on a high alert in regards to coronavirus. He arrived through LAX from another country where there was known to have coronavirus. He was not screened. He didn't have a temperature check. He had his mask on because they were wearing masks in Taiwan, but when he got there, no one else was wearing masks, you know? So that was kind of like the gateway of the virus coming to the United States through the airports. And I will speak to the fact too, that there are a few, there's been some discussions about mutations of the virus. So the virus has been mutating all along. You know, it's a very smart virus, and as many people that we have had infected, it's going to, you know, shift and change, trying to accommodate for what we're trying to do to it. And you may have noticed that in March and April, there were a lot of sick people, a lot of deaths, and then things subsided a little bit. And I think that's because another strain came out at that time. You know, a different strain came out. But now I'm seeing an uptick in more significant and severe cases again, suggesting to me that there's another uptick of another strain that's out there that's more significant than it was the previous time. So I'm hoping and praying that this one will be short-lived and not take too many lives while we wait for the next phase or the next strain to come about. Okay.
Do the strains get weaker?
Like I said, back in the summer, people had certainly milder symptoms, and now I would say that they're stronger again. I mean, that virus is more significant again. And now how that plays back to the vaccine is that this vaccine was the Moderna and Pfizer vaccine was pretty smart in its development, is that they have made the vaccine attack the antibodies are against the spike on the coronavirus. So no matter how
Right.
much it mutates, the vaccine is still going to attack the spikes on
Those
that
spikes.
coronavirus.
Mhm.
It's not going to attack the inside of it, which is the part that's mutating. The genetic makeup of the virus is what's mutating. So that's good in regards to those vaccines, so that we can continue to rely on them as the virus continues to make changes, small changes it's making throughout, because there's so many people being affected by it.
All right, answer your questions in the chat. I'm done.
And so what is the distribution hierarchy? So and we kind of went over that. Group 1 is going to be healthcare workers and long-term care residents and workers. Group 2 are going to be those people over 65. Then frontline workers are going to be in group 3. And then the average person with healthcare concerns or chronic conditions are going to be in the next group, and then everyone else in group 5. And hopefully to have, in my eyes, I would think it would be ideal to have group 5 participants or have group 5 activated by the fall or by the summer, would be my hopes, fingers crossed, in regards to that. Which vaccine has the least side effects? They are actually about the same in regards to the side effect profile. I will say the effectiveness of the vaccines are also about equal, meaning through the research, the amount of reliability of the vaccine, both Pfizer and Moderna are very equal. There are a few others that are in the pipeline, one from AstraZeneca and one from Johnson & Johnson or Janssen that are in the pipelines too, but they have not come through the FDA yet. And are there some people who are who medically should not receive the vaccine due to allergies? I would say yes. Again, to discuss those people who have allergies significant enough that they need to carry an EpiPen should have a discussion with their healthcare provider about what their risk is. And it may be that their EpiPen use is because they are allergic to bee stings and not because of medications. I have one patient that has significant allergies to many different things in the environment, and she needs to carry an EpiPen. She may not be a candidate for the vaccine. Please share how long the adverse events last. So my arm soreness, 24 hours. Based on the research, it was 24 to 48 hours. And my arm pain was alleviated with the Tylenol. And I did that the next day. I was trying to give it as long as possible to see how long it would last, and then to do a second follow-up to see if it would resolve with any medication like Tylenol. And it did. I then at that point haven't needed anything else. Everything resolved thereafter. So my one-person study said that it was minimal, and it was resolved with an over-the-counter treatment of one Tylenol.
Do we have any other questions? No more questions? Okay. So no one has any other questions. Well, I think that this has been absolutely awesome for you to have a clear understanding and for you to make a decision on what you want to do. But this gives us more insight, more education on how to take care of ourselves and how to take care of those people we love, and then just people in general. So I wanted to have Ms. Peacock with us. She's awesome. She's wonderful. She's just a great person. And I thank God for meeting her and we still being so divinely connected. So if you have any questions, there's websites you can go to and whatnot. If you need a good doctor, I will refer you.
I would say too, if you have anything that come up, Ms. Shirley, and you want me to clarify anything, you can just shoot me an email and I can give you clarification on anything that comes up.
Okay, I thank you so much, Ms. Peacock. Thank you. And we thank you for joining us on tonight. And we celebrate you and just all your efforts that you do in the community and all the achievements you've done to continue to help us move forward. So thank you so much. And we're not going to hold you any longer, and I'm not going to hold them much longer either. And I appreciate you. Thank you so much.
Absolutely. Thank you.
All right. So I hope you all enjoyed Ms. Peacock on tonight, because she has done such an awesome job in giving us instructions, and so that we know how to move forward. That decision is up to you, but at least we have information, so we know what to do. So I want to thank you all for taking the time to come and be with us. I think that, in the church community, we so focus on just us that we don't have all the information that we need. We need more information about how to do different things, how to address different things. And I'm thankful that God has given us that opportunity, that we are connected with other people that can come in and teach us. So I want you to take the information that you've heard on tonight. If you have any questions, feel free to send some out if you do have any. And we'll try to do what we can as a local body to get you the information that you need. So remember to pay your tithes on tonight. Remember to sow your seeds and your offerings on tonight. Also, everything is still as follows with our announcements and everything. On Sunday, we will be at home. We will continue to be at home for the rest of the month. So the services will be coming from my home. And then in February, our team is going to try to go back in and broadcast live from the sanctuary, just our team. We may allow 1 or 2 in from time to time. And then our plan for March is to try to do a couple of services on Saturday and to shoot for Sunday services, but this is not a full house. So we're just gonna play it and see how it goes. I give you my plan, and if God changes his plan, then he changes his plan. The ways of giving is on the screen. Give as according, your tithe is always to be given, that is the Father's, and then you sow your offerings and you sow your seeds so you can have a harvest. If you want to give directly unto me, if I've been a blessing to you, that is $Arise and Soar, my new Cash App, $Arise and Soar, or Zelle, which is Shirley R. Brown at att.net. PayPal also is Arise and Soar. Given directly to the ministry is destinyintministries.org, and it is an online giving on the website once you go there. And of course, you can always mail your seeds in to at 3329 Forceville Road, Raleigh, North Carolina 27616. All righty, so I appreciate you all for taking the time. I hope this was valuable information out to you on tonight. I hope you will take some time and think about some things, and please continue to take good care of yourself. Follow the instructions, taking care of yourself. And of course, we continue to pray. We also will be starting our fast on February the 1st. Our prayer time, we've had 21 days of prayer. Our prayer time is going to end those 21 days. We're not ending prayer, but just those 21 days of constant prayer will be ending on the 25th. And then after that, we will go into our fast. And I want you to understand, in February the 1st to the 21st, that will be our fasting time. I'm giving you that opportunity to determine how you can fast because of health conditions and whatnot. If you're going to fast 1 meal, then you'll do that. If it's 2 meals, if it's 6 to 12 hours, if it's 6 hours or 12 hours, I'm going to let you determine that, because I never want to see anybody failing at something because we're called it together as a corporate event. So I'm going to let you determine that, but you be faithful to what you determine you're going to do, and God will bless you, and he will strengthen you, and he will keep you. So on tonight, I will close out with a short prayer. Blessings be unto you as we continue to move forth in the things of God. So Father, each person that was on the live on tonight, we just pray for them tonight, God. We pray that they had an ear to ear, and decision making and wisdom will be their portion. And Father, we just pray protection over everyone connected to Destiny International Ministries, those connected with us in any way. And Father, we just pray for our country. We pray for our nation. We ask you, Lord, to put that covering blanket over us as we begin to start anew, God. I pray for unity in the body of Christ. I pray for unity in our nation. I pray, God, that we lift our hands up, God, to you and get our wisdom and knowledge from you, God, and that we apply our lives according to the word, how you have planned it out for us. And in all things, God, we will acknowledge you. And in all things, we will give you glory. And Father, we pray a blanket of healing to be over us too. Mental healing, physical healing, emotional healing. God, this is a time that the nation shall be healed in Jesus' name. In all things, we will honor and glorify you. So good night, everyone. Have an awesome night. And thank you again for joining us on tonight. Bye-bye.